Billing H0015 wrong is the fastest way to leave IOP reimbursement on the table. 3 hours is 1 unit of H0015. Bill 6 hours as 1 claim, and you just gave away half your reimbursement. What H0015 is, how units work, required documentation, common errors, and how purpose-built software connects documentation to clean claims. What it covers, how units work, required documentation, common errors, and software that connects documentation to clean claims. H0015 is the HCPCS code for Alcohol and Drug Services Intensive Outpatient Program. It bills for structured, multidisciplinary substance use disorder treatment at a higher level of care than standard outpatient. Your program must run a minimum of 3 hours a day, at least 3 times a week. Programs cannot use cookie-cutter treatment modalities. Each patient needs an individualized plan with assessment, counseling, crisis response, and educational components. Generic EHRs are not built for behavioral health billing. Behave Health's RCM includes a curated database of behavioral health codes across all payers. When your clinical team completes attendance rosters in the Behave EHR, billing information automatically flows to the RCM module. Purpose-built code logic and real-time billing cycle visibility, not available in a generic platform. H0015 is billed in units of 3 hours. Get that wrong and you underbill every session. 3 hours is 1 unit. Billing 6 hours as a single claim instead of submitting H0015 twice means underbilling and lost reimbursement. Failing to obtain prior authorization when required is one of the most common and preventable H0015 billing errors. Inadequate documentation of medical necessity for the intensive outpatient level of care is grounds for denial or post-payment audit. 4 requirements determine whether your H0015 claims hold up at submission, at audit, and on appeal. Miss any one, and you risk a claim denial or a compliance finding. Requirement 1. Program structure. Your IOP must run a minimum of 3 hours a day, at least 3 times a week. It must involve a multidisciplinary treatment team. CMS has specific guidelines for program staff qualifications and duration of services. Your clinical team completes attendance rosters and notes for each session, documenting the services provided. Requirement 2. Individualized treatment plans. Each patient must have an individualized plan including assessment, counseling, crisis response and intervention, and educational components. Cookie-cutter programs do not qualify. Documentation must show the plan was tailored to the individual and updated as the patient progresses. Requirement 3. Prior authorization. Most commercial payers require prior authorization before IOP services begin. Verify before the patient's first session. Failing to obtain prior authorization when required is one of the most common H0015 billing errors. Secure it before services begin. Requirement 4. HIPAA-compliant documentation. Providers billing H0015 must adhere to HIPAA regulations when handling patient information related to substance abuse treatment. Staying compliant requires regular audits of billing practices, ongoing staff education, and written policies that prioritize compliance. H0015 is where payer variation creates the most friction. Here are the differences that matter most. S9480 covers intensive outpatient psychiatric services and is billed to private payers only. Public payers do not accept S codes. Some commercial payers require H2036, Alcohol and Drug Treatment Program, per diem, instead of or alongside H0015. Claims filing deadlines vary by payer. Submitting past the filing deadline is a common billing error you can avoid by tracking each payer's deadline. H0015 is the core IOP code for substance use disorders, but not the only code your billing team will encounter. H0015 covers substance use disorder IOP. S9480 covers intensive outpatient psychiatric services, mental health treatment, billed per diem to private payers only. Do not confuse H0015 with H0035, the partial hospitalization code for mental health treatment, a distinct higher level of care. Stop underbilling your IOP. Get the unit logic, prior auth tracking, and documentation workflow built into your platform. See H0015 billing built into your workflow. Book a 20-minute demo at behavehealth.com.